Welcome. Hello everyone, welcome back to my channel. So today we are going to start another topic that has been asked for a 5 mark, that is Ramsay Hunt syndrome. Okay, so we will see what this syndrome is and why it is asked for 5 marks in the university. So what should you write in those 5 marks? Right, let's begin. So this is going to be the continuation of viral infections. I have uploaded a few infections. This is the next one. So starting with Ram Hunt syndrome. Ramsay's Hunt syndrome is a special form of zoster infection. Okay, so it is a special form of zoster infection of the geniculate ganglion. Okay, so there is a ganglion that you have to mention is the geniculate ganglion. Okay, then so it is a first point is it is a special form of zoster infection of the geniculate ganglion. Second point is it is combination of cutaneous lesion of external auditory canal and involvement of the ipsilateral facial and auditory nerves. So this is a syndrome of the ganglion. So anything that is associated with the ganglions has to be associated with the nerves. So it is a combination of a cutaneous lesion, so it occurs cutaneously with the external auditory canal, involvement of the ipsilateral facial and auditory nerves. So there are the involvement of 2 or 3 things. First is the external auditory canal. Okay, this is the first thing, that is your external auditory canal involvement. Second is your ipsilateral facial and auditory nerves involvement. So one is your auditory canal and second is your auditory nerve and facial nerve. Okay, auditory and facial nerve. Now coming to its clinical manifestations. What are its clinical manifestations? First is facial paralysis. So facial paralysis occurs as a result of this disturbance in this geniculate ganglion. Okay, then pain of the external auditory meatus and pinna of the ear. So the pinna of the ear pains. Okay, this let me just make it look like an ear. So the pinna of the ear pains and the external auditory meatus. So there is a pain in that region. Then there is hearing defect as well, and there is something called tinnitus, a sound like a tingling sound or like a ting kind of a sound is always present in the ear, that is called as tinnitus, or it is a hearing defect. Okay, tinnitus. Then you have vertigo because of the fluid which is present, that because of that you have vertigo, and other auditory vestibular symptoms. Then vesicular eruptions in the oral now what about the oral manifestation of this syndrome? So it has a vesicular eruption in the oral cavity. So there are vesicles which erupt in the oral cavity and in the oropharynx. Okay, then hoarseness is seen, hoarseness of voice is seen. Okay, so vesicular eruption in the oral cavity and hoarseness of voice. Then coming to the patients patients thought to have Bell's palsy. So we discussed that paralysis is one of the symptom or clinical manifestation that is seen in 30% of the active cases. Okay, and it is demonstrated by antibodies or PCR. Then coming to the chronic phase. So as we see, there is a chronic phase in this where the patient progresses to chronic phase characterized by pain in the post-herpetic neuralgia. Okay, so there is a pain which is termed as post-herpetic neuralgia for more than 3 months. Okay, 3 months plus. There is a persistent chronic pain which extends for more than 3 months. Such a pain is called as post-herpetic neuralgia. Then there is pain burning sensation, throbbing, aching, burning, aches, itching, stabbing. So these are all the sensations that are felt in this syndrome. Pain, burning, throbbing, aching, itching, and stabbing are the symptoms that are seen in this type of syndrome. It is often with flares which are caused by light stroking of the area. Okay, so flares are developed because of the stroking of the area caused by light stroking of the area. So if you stroke the infected area, there is flares. Okay, so there are flares because of stroking. Then from contact with the adjacent clothing. Okay, so if the clothing gets in contact with the infection, there is flares at that time as well. Now most neuralgias resolve within a week, within a year. Most neuralgias resolve within a year. Rarely it lasts up to 20 years. Then coming to the histopathology, the histopathology is very similar to HSV. There is acantholysis with formation of free floating Zang cells. Okay, there is acantholysis and there is edematous cells, which are your Zang cells. Then these also exhibit nuclear margination of chromatin, that is your, we read it as nuclear beading. So this also shows nuclear beading because the nuclear is, and there is nuclear margination of chromatin, and occasionally you can see multinucleation as well. Then diagnosis, it is made diagnosis. How is the diagnosis made? Usually from the clinical presentations. Then we take the sample and we culture it. That is your cytological smears also can be taken for the Zank's test. Then fluorescent antibody staining test can also be done. Then there are a few minor molecular techniques such as PCR, dot plot hybridization. Now coming to the treatment is, since it is also a viral infection, then you have to give a cyclovir or valacyclovir. Okay, and NSAIDs if there is any pain, and systemic corticosteroids. Okay, so that is about Ramsay Hunter syndrome. Okay, so this is all you can write in a 5 marker. Thank you for watching.